Thank you for connecting. We will start the lecture soon. Let me see. Let's see if any other people can connect. So I will start in 2-3 minutes. Let's see. Well, it's 6:05. We invite the people to connect at 6 p.m. So I'm Dr. Carlos Rojas. I'm urologist. I work in, as a lot of people here from the island knows, I'm urologist and I work in San Martin Medical Center. And we're going to, this time we're going to talk about erectile dysfunction. Before starting, I would like to thank MyTech. This conference is sponsored by MyTech. And let's talk about erectile dysfunction. First of all, the penis is of course, is the reproductive male organ that it has the function of the penis is, of course, to have sex, has a reproductive function, and also is the final part of the urine system. So has a reproductive function, and also it's important to bring out the urine from our system. So how an erection occurs. So imagine when you launch a rocket. To launch a rocket, you need a lot of sequence moments that makes the rocket launch. So the same happened with sex. So to have an erection, first, you need to have your neurologic system needs to be accurate. So all the nerves from the brain to the penis has to be intact to have an erection. So with those nerves, they take some substance to the penis, and the final result is that the arteries of the penis get dilated and the penis fills with blood. And you see that the penis has like a wrap that we call the tunica albuginea. So the wrap is important to hold all the blood and to make the penis rigid and thicker to have to of course to have sex. So how many kinds or how many types of erection we have? But because the normal erection that we know is the psychogenic, is the erotic erection, is when you have the in your brain, when you think about an erotic in an erotic moment, or when you see your wife, you see your girlfriend, so you have all those images in your brain. So if you have a neurologic intact system, all the nerves connect with the penis and you have an erection. But we have other two kinds of erection. We have the nocturnal erection that are physiologic, are erotic related, and the nocturnal erections, we see them during the normal sleeping cycle. And we have the reflexogenic erection, that is the erection that is only we see in patient with when the spinal the spinal cord is damaged. You see the reflexogenic erection. So normally we have psychogenic and nocturnal, and in some patients with spinal cord lesions, we see the reflexogenic erections. So what you're going to find having sex brings a lot of benefits to our health. So first of all, it's important to we relieve stress. Sex is important for that. Lowers our blood pressure, boosts our immunity. Imagine with all this COVID situation, what we can do having sex. Provides exercise, you burn calories, improves cardiovascular health. You boost, of course, your self-esteem. Having sex, you look at, I feel great. I feel because I had sex. Of course, strengthens your well-being, improves intimacy, reduces pain, reduces the risk of prostate cancer, and strengthens your pelvic muscle floor. And of course, after you have sex, you get a good sleep. So to have sex, we need an erection. So we need to see what's erectile dysfunction. So when we have a persistent or recurrent inability to attain or maintain penile erection sufficient for sexual performance, that's what we call an erectile dysfunction. So when we're not able to penetrate the vagina, and this problem is persistent, so we have the erectile dysfunction. Sorry, I have a call. Okay. So the incidence of erectile dysfunction, it's with age. You see in males over 40 years old, the incidence is 40%. But while we get old, over 70 years, you see the incidence is higher. We can see it also in this slide. you see how is the incidence grows with age, and also the severity of erectile dysfunction is proportional with age. We see more incidence. Sorry. We see more incidence of erectile dysfunction, and the severity is also also more higher. So in even the cause of erectile dysfunction, when we see in patients under 50 years old, the psychogenic cause of erectile dysfunction is higher. But while the patient gets older, the arterial and non-arterial, what we call the organic cause of erectile dysfunction is higher, and the psychogenic is lower. So as we were talking about the vasculogenic means the arterial cause of erectile dysfunction is the most common. So is the most common cause of erectile dysfunction, but also the pharmacologic pain, the medication for high blood pressure, patient who had surgery. The endocrinologic cause is very important when you have a low testosterone, or your thyroid is not working good, or you have a diabetes, so you can have erectile dysfunction. But mostly the major cause of erectile dysfunction is vasculogenic. Vasculogenic means that the arteries of the penis get blocked. So when we see the psychological causes of erectile dysfunction, we have to think that the patient is under stress, the patient can be can have some anxiety, performance. Depression is very important, is a very important cause of erectile dysfunction. Loss of interest, relationship problems is very important when you have problems with your couple. And of course, if you don't want to be treated, if the patient don't want to go to the doctor, if the patient is not compliant with the medication, so you're going to see that erectile dysfunction. So understanding erectile dysfunction like an arterial problem is when the arteries get blocked. What are the most common causes why the arteries get blocked? So we have to think tobacco, cigarette smoking. When your cholesterol is high, dyslipidemia, triglycerides high and cholesterol high, diabetes, hypertension. So all these problems you're going to have an oxidative stress, and that stress can damage the arteries of the penis, and you have the final result is erectile dysfunction. So we also need to understand the erectile dysfunction as a vascular disease. So how we see here, we imagine this is the diameter of the cavernous artery. This is the coronary artery, is the heart arteries. The carotid is the brain artery, and this is the artery of our legs. So you can see how small is the artery of the penis, and the first artery that is going to be blocked, because it's the most thin artery, is the artery of the penis. So we have to see when we have a vascular disease, erectile dysfunction can be a predictive problem to have a vascular disease. What we see first in patient is erectile dysfunction. So we can see here, this is the normal artery, and while it's blocking with cholesterol, smoking, diabetes, high blood pressure, and you see that the final result is the artery gets blocked. And finally, you're going to have a decreased blood flow, and the final result is having the erectile impairment. So what we do as doctors, when a patient has erectile dysfunction, so we have to, the patient needs to explain us when how much time you have the problem, and if it's a persistent problem. And of course, we need to ask if the patient has any of these problems: diabetes, high blood pressure, dyslipidemia. Dyslipidemia is high cholesterol, or the patient has he lose his sex drive, or we have to see the sexual history, of course, and what kind of medication he's taking, and if the patient has a surgery, because sometimes the patient has a surgery for prostate cancer, or have a pelvic surgery, or had a trauma. Of course, the physical examination includes the examination of the wraps of the penis. There's a very important disease, Peyronie disease, when a plaque forms in the penis and can bend the penis, and you can have erectile dysfunction, and you're not able to penetrate the vagina because you have the penis is curved. So, and also you need to, we need to do the examination of the prostate. And we can also see if the patient has phimosis. Phimosis is when the foreskin is too tight. So it's very important to see if those patients has those kind of problems. So, and the lab testing, the most important thing is we have to rule out if the patient has diabetes. So we test sugar, we test testosterone, and of course we have to test all the lipid profile to rule out if the patient has a dyslipidemia. There's other tests, but there's more specialized, like ultrasound, to measure the speed of the arteries, the speed of the flow, the blood flow of the penile arteries. And we can also test with an injection with a substance inside the penis to reproduce an erection. But this is our very specialized test. So let's speak about the treatment for erectile dysfunction. So first of all, changing our lifestyle. That's a very important part to treat the erectile dysfunction. So that means quit smoking. Quit smoking is very important. Eat healthy, exercise, of course, lose weight, and sometimes we have to limit alcohol, because alcohol is a very important cause of erectile dysfunction. And the pills, because the pills are very popular, like Viagra, Cialis, Levitra. It's a very popular treatment for erectile dysfunction, and we can see here the efficacy of the pills is around an average between 60 and 70%. So all the patients, there's like 30% of patients that don't see progress with the pill, but is a very popular treatment for erectile dysfunction. There are proof that they're safe. What the difference between all the tablets for erectile dysfunction is the bio how they work, because the sildenafil, for example, the half-life is between 3 and 5 hours. That means that it works for an average of 4 hours. But if you have tadalafil, the half-life is around 17 hours. So the duration of the action of the tadalafil is more longer of the sildenafil. But if you have side effects of the medication, you also going to have side effects for 36 hours. So that you have to explain the patient all the different kinds of medication we have. But it's very popular to start, and the guidelines said that the first line of treatment is the oral therapy. So is like I said before, in this slide, you can see that the first line of therapy for ED is the tablet, the pill. So, but we have to. It's very important to change our lifestyle and take the pill to see a result. Of course, if the patient has a low testosterone, we also need to replace the testosterone. If the patient has a high or a low prolactin, we have to send the patient to the endocrinologist to treat the problem. So if the patient has a high cholesterol, we have to send the patient to the internist to treat the cholesterol, or we have to send the patient to the house doctor to control the sugar and to control the lipids, the high lipids. Oh, this is another step in the treatment for ED, the injections. The injections, there were, before the era of the pill, the injections were very popular, but patients are not very complain with this kind of medication because you have to auto-inject the penis. So some people, they don't feel comfortable with this treatment. And this is another kind of therapy is the intraurethral topic of a medication that it calls alprostadil. But the problem with this medication is that you have to put that substance inside the urethra, and sometimes you can have some burn after you take the medication. So the medication exists, but is not popular in the ED treatment. The vacuum is you have to place this vacuum device, in the penis, and you have to squeeze the device and take out the blood to the penis. So it is not popular because you also have pain with this kind of device. So after the pill, what is the best treatment for erectile dysfunction? Are the penile implants. The penile implants are definitive, are effective, are safe for treat erectile dysfunction. So we have different kind of penile implants. This is the most simple ones. This is the semi-rigid implants. the semi-rigid implants, the penis is going to be also rigid, so you can manipulate the penis, and you can hide the penis when you're not having sex, and when you want to have sex, you can bend the penis, and the only reason to have the penile implant is to give rigidness to the penis, and you can have sex. You can have penetration. You can have penetration, and of course you enjoy life, enjoy sex, of course. And this is the semi-rigid is like the simplest implant, but this is the number in our guidelines. The inflatable penile implants are the best treatment for erectile dysfunction. Why? Because the inflatable penile implants, they reproduce what the penis do. When you want to have the penis in the flaccid face, you pump the use the pump and take all the fluid out of the penis, and you're going to have the penis in the flaccid face. But when the patient wants to have sex, you squeeze the pump, and all the fluid from the reservoir fills the cylinders of the implant, and the patient have sex. A lot of patients ask about the sensibility of after the penile implants. So, I will say that all the sensation, orgasms, the emission of the seminal fluids, the patient, if the patient don't have a surgery, the patient will have all the function, the sensation. The only reason you get the penile implant is for give a rigidness of the penis. So all the sensation, all the urinating function, all the emission of semen, the patient conserves all those functions. So the only reason of the penile implant is to give the rigidness of the penis, and the patient is going to have all the normal sensation and function to have sex, and to, of course, to urinate. And if the patient wants also reproduction, you can have reproduction with a penile implant. So finally, I like this statement is from Leon Tolstoy, that he said that man survives earthquakes, experiences the horrors of illness and all the tortures of the soul. But the most tormenting tragedy of all time and will be is the tragedy of the bedroom. Thank you very much. So you're able to do questions. I'm here to your questions if you're ready. Any questions? So there's a question. I'm reading a question here on this side. Let me see. Stop sharing here. If there's any okay. Questions? Okay.
Doctor, you have one in the WhatsApp.
In the WhatsApp. Can you, okay. You in the WhatsApp, how can I have this question? The question. Okay. And the WhatsApp. Okay, I got it. So I am a 67-year-old male, and I was diagnosed with prostate cancer in 2013. This is a question. Had a radical prostatectomy in September 2013 with the surgeon using laparoscopic method. I also had to undergo radiation therapy to the prostate bed as the PSA count was more than acceptable. Currently, my PSA level fluctuates between 0.04 and 0.01. And I have been on Androcur for the past 6 months, but I am now off as my sex drive was diminished. Side effects. Since I have had problem achieving an erection, evidently the nerves were damaged, destroyed, resulting in my current condition. I tried Cialis for a while with a very little success. My question is, will I be able to achieve erectile function for any form of treatment? So in this patient, 67 years old, he looks, now he survived prostate cancer. He had treatment, he had surgery, he had radiotherapy. So having surgery and having radiotherapy, the probability of have artery damage of the penile arteries is very high. So in this type of patient, also having Androcur is a medication that blocks the testosterone production. So it blocks the testosterone production. So this patient we're going to see the progress with the pill is going to be very, very low. So this patient is for a penile implant. So we need the first recommendation of this for treating erectile dysfunction in this patient is to have a surgery and do a penile implant. In this case, we prefer the best is the 3-component, the one that is inflatable. That's the best option for this patient. So we have another question. Would you say that diet and exercise are the best way to treat ED? Well, changing our lifestyles is the first part to treat ED. It's not the best, but if you're not eating well, you're eating oily foods, fatty foods, and you don't do exercise, of course, you're going to have risk to have a vascular disease. And the first vascular disease that you're going to have is an erectile dysfunction. But if you progress, you're going to have risk to have a myocardial infarction, or you're going to have a stroke. So the first part of the treatment is changing our lifestyle. So eating healthy and reduce our weight, and also doing exercise is not the best, but it's the first line of treatment. There's another question. How safe are the tablets with all those side effects? So the tablets for erectile dysfunction, of course, is the first line of therapy for erectile dysfunction. How safe they are? They're very safe. They're very safe. If the patient don't have a history of having a myocardial infarction, you can give safely the erectile dysfunction ED tablets. So, but the efficacy of the tablets is around how I was saying before, the efficacy is around 70%. Let me see if there's another questions. So a lot of people ask about uh, the, uh, the question that when people come to our office to ask for erectile dysfunction, uh, of course, the oral medication is our first line of treatment, but patient always feel some scared to have the tablet, but these tablets have been proven for a long time, and the safeness of the tablet. And while you take more of the tablets, the probability to having side effects is going to be less. And about penile implants, about penile implants, of course, the best option, because it's definitive, after a penile implant, you're not going to need no medication. The recovery, it's when we do a penile implant surgery, the surgery is around it takes like between 1 hour, 1 hour and a half, can be less. The recovery, the patient will be admitted for 1 night, and he's going to be discharged the following day. And of course, the patient needs to heal to use the penile implant. So it takes around 6 and 8 weeks to try to have sex with a penile implant. Of course, just after the surgery, the patient can have a slight tenderness of the penis, and the sensation is going to be quite less. But after the surgery, after 3 weeks, the sensation of the penis is totally normal. Let me see. I have another question here. There's another question about the dependency of the pills in order to enjoy sex. So with this medication, the patient don't get dependent. Sometimes when the patient responds with the pill, well, all the time they have to take the pill to have sex. So of course, as long you use the pill, you're going to have less side effects. But to be dependent of the pills, that's the reason sometimes sometimes we need to recommend a penile implant if the patient depends on the pill every time. There's another question here. Can cognitive restructuring help in ED? Okay, so if we think that the major cause of of erectile dysfunction is vasculogenic, or as I was saying, that the arteries are blocked. With restructuring, cognitive restructuring, you're not going to see any progress. So probably if this patient, if you see that the erectile dysfunction in young patients, or in patients with depression or anxiety, you're going to see some progress in this kind of patient. But in the major causes, in the major patients that comes to consultation that are diabetic, they have high pressure, they have surgery for prostate cancer, cognitive cognitive treatment is not going to help. So there's other questions. If there any questions? Well, thank you for your time to hear me. Let me see. I'm very glad to answer your questions. There's other Steve Graves is asking about how safe are the tablets with all those side effects. The tablets for is like what I was saying. The tablets for ED are safe. Are safe. They're being used for a long time. They're being used for a long time, and they are safe. So you can see slight side effects. The major side effects are blushing in your face. You can have some pain in the lumbar, in the lumbar area, or you can see some some runny nose. But normally the side effects of the pills, so the patient can receive the medication. They normally they can complain with the medication. Let's see if there's other questions.
It seems there are no more questions.
No more questions? So if there's no other questions, I would like to thank you for for all the people that connect. Thank you for MyTech to sponsoring this lecture about erectile dysfunction. So we used to have, of course, live meetings and lectures, but with this pandemic situation, so we're trying to give some information to the population, and having this social network. So So well, I'm very glad for all the people that connect, and thank you for MyTech to sponsor this meeting.
Thank you, Doc.